I am the Adult Caregivers Coach, Donna Jackson. And today we are in for a treat, guys. We have with us Shannon Brooks. Shannon is going to give many of us a new lens through which to view medical insurance benefits. Shannon will introduce us to intriguing insights and myth busting approaches to aging without insurance. The mere thought of aging without insurance or just not having insurance for most people is frightening. So, with that, Shannon, tell us a little bit about yourself and how you've come to be an expert in this space.
Okay, well, first of all, I just want to tell you thank you so much for allowing me to be on your podcast. And I am Shannon Brooks. I'm born and raised in Winston-Salem, North Carolina. I have my own company called Brooks and Associates, LLC, and I am a financial services specialist. So what I do help people in different areas. I do help people in the area of financial literacy. I'm also a life and health insurance agent, and I also help people with credit. But the main thing that we're going to talk about today is my expertise in the world of health insurance. So I have been in business now for almost 20 years, but prior to me becoming a licensed agent and starting my own business, I was actually in the world of healthcare starting back in 2001, I believe. So I worked at United Healthcare. Most people, they know of them. They have pretty much a good reputable company. But I started working with them in the area of benefit special. I was a benefit specialist. So what it was is that I was the one that when you called in, you learned about your benefits, things of that nature. So I was always just intrigued about how health insurance really worked. And then what I learned from United Healthcare, along with becoming a health insurance agent and just, coming along the way and just researching and observing and watching, I just realized that, hey, you know what? There's also alternatives out here that most people don't think about. And that's where I am right now. So I know sometimes people may say, oh, you are cutting your money when you talk about this. But I'm big on integrity, and no disrespect to any other health insurance agent that they specialize in this field. Because like I said, I'm also an agent, but I'm also big on just showing people how they can actually, in a sense, do it on their own.
That is amazing. And it's so true that most of the time when we see people who invent or create solutions for others, it's because they were proximate to the same problem or issue, and they had insight or an experience with this thing that they said, man, I can help some people here. So I just love that. And, to your point, you're in this space. This was your livelihood. And this is when you know that it kind of shifts from being a livelihood to your ministry, right? Where you said people are saying to you, man, you're cutting into your money. No, I'm serving. Like I'm serving, and I am going to reap the benefits and the blessings of it regardless.
That's
So,
right.
oh man, I love that, Shannon. All right, so let's talk more about how you advocate for people in general and the elderly loved ones we care for specifically as it relates to this medical insurance alternative that you're introducing us to today.
Okay. Well, I would say I always like to call the senior population or the elderly population seasoned, because I have a mother who is 74, and I bet not call her elderly or senior. So she is seasoned.
Yeah.
So I always say when I talk with my seasoned, I guess, I don't like calling people clients. I like to call them my family, my friends. So they become my play auntie, my play uncle. I believe in family. So, but so what I normally try to, tell people, and also tell the caregivers of, the ones who, happen to be seasoned, is that a lot of times the seasoned, population, they're very used to a certain way of doing things. And it's very hard sometimes, very challenging to get them away from thinking that way because that's all that they have known. So a lot of times what I have to do, and I sit down and I talk to, whether like I said, it's a caregiver or whether it's someone that's seasoned, I always say, sometimes, things, can change. And if you think about doing something in a certain manner that's going to actually help you and to be able to save you some money, will you be willing to listen to me? Because one thing about those that are seasoned, they believe in saving that thing called a coin. Now, my generation, I'm 48. Now, we're going to spend all our coins, as I call them, our coins. My mother's generation, oh no, they don't want to spend anything. They're going to save and hoard everything. So I have to sometimes retrain the brain. And that's what I try to tell people a lot of times. Once you can retrain the brain and think differently and think outside the box, sometimes all I have to do is just say, you know what? Can I show you a method that you can actually save money if you tell them that you don't have coverage? Okay, Shannon, I'm listening to you now. Okay. Same thing when it comes down to the caregiver. A lot of times, most of the time the caregiver is a child or grandchild. So most of the time that caregiver kind of sometimes falls in that middle-aged adult, phase, kind of like I said, where I am. So a lot of times I'll say, well, look, let's think of it like this. It could be a win-win for both sides. As a caregiver, you can learn something that you can also do as you get a little older and things that you may be doing now. And then when it comes down to, your loved one, you can actually sit down and say, hey, mom, hey, dad, hey, aunt, hey, uncle, hey, grandma, grandpa, whoever, let's look at a different way of doing these things. Because like I said, a lot of times when it comes down to the world of health insurance companies are out here to make money. That's all it is too. And I can't knock them for that. But at the end of the day, guess what? If there's alternatives that you can use that can save you money because you're not dependent on that health insurance, wouldn't you like to do that? So whenever I come from that standpoint, they're like, okay, well, tell me a little bit more. Like, what can I do? And then at that point, that's when I, go a little bit further. Because one thing about this method, I tell people it's not for everybody. I put that disclaimer out there all the time. It is not for everybody. And sometimes it don't work. I'm just being honest. It's good, bad, and ugly with everything out here. Everything. And even in the world of healthcare, it can be good, bad, and ugly. Because you may have some, providers out here who are like, nope, if you don't have, coverage, you can't come see me. And sometimes you run into that, situation. So I always say, once we can sit down and we can talk about the good, the bad, and the ugly, how it's going to benefit you, how it may blow up in your face if you don't do it right. And also to know that you have to have discipline with it, because in a sense, you're becoming your own HSA account. And a lot of times with doing that, you have to have discipline. Yeah. So that's why I say it's a lot of stuff that goes on sometimes behind the scenes, but I'm just always going to be transparent and tell people up front, even if it is the caregiver, like, can you, sit down? Because sometimes when it come down to, the seasoned, individual, they're very smart. They're very intelligent. But sometimes, I'm like that at 48. I'm like, what was I just doing? Where's my phone? I know I had a pen around here somewhere. Who took my pen? So it's the same way when, as somebody's in their 70s. So you have to sometimes be able to be that person that's going to have patience, discipline, especially if you are handling, the seasoned person's bank accounts, or if you're their healthcare power of attorney or what have you. So it's, it's a method, but it's, you have to have discipline behind the method. And if you don't have the discipline, which is fine, then this may not be a method that you want to look at. Yeah.
Yeah. As a part of what, we do in this podcast, like, I bring experts like you to come in and talk to my caregiving community. Then we put the podcast in front of them so that they can then look at them and have questions and bring them back to our caregiver connection community. And that's where we come real talk in real time about questions they might have about the podcast each month, or just questions that they are wanting answers to, wanting to get some relief in terms of what's going on in their caregiving journey, specific to them and their elderly loved ones, right?
Mm-hmm.
When we talk about our seasoned loved ones, how, and let me say that one of the things that you talked about is that mindset, changing that mindset. That's one of the things that we do in our coaching with the caregivers, because when you can help them address the mindset as to what they're engaging in, regardless of what it is in the season, it's super helpful, because a lot of times most of the time, that's where everything stems from. How are you looking at this? How are you seeing the situation? You also talked about how people are committed to or married to what they've always done. I think of my grandma. This is years and years, decades ago, as a matter of fact. And when, for whatever reasons, the insurance they have changes, and some doctors now are not accepting that insurance, and they have to now go to another doctor, a different doctor than who they've been going to for their whole lives or something like that. What are some of the ways that you can have this conversation with them that says, if we implement this alternative, it may mean you have to see another doctor?
Well, for me, a lot of times what I tell, people is, because that happens all the time in the world of insurance, is in network, out of network. And like you said, a lot of times doctors will come in and out of networks all the time. And a lot of times the reason they're doing that is behind the scenes is about negotiations, contract negotiations, how much they're going to get, how much the health insurance company is going to get. And then sometimes they're like, you know what, I just rather just step out of it and I'll be part of our network. But what I normally try to tell people is, what if you were to go to this same doctor? Because sometimes, there are doctors that people, it's like the doctor becomes a part of the family.
Mm-hmm.
They love that doctor. They don't want to go see anyone else. That doctor knows them. That doctor knows their children, their grandchildren, their dog. They know everything there is to know about this person. So normally what I would try to do is come in and just say, you know what, if there was an alternative method that you could use to still see your doctor, would you be willing to sit down and listen to what I'm saying? And if they're like, oh, yes, because I don't want to see anybody else. Because once again, when it comes down to those seasoned, that seasoned population, they don't like change at all. So whenever they say, okay, yeah, what can I do? I said, well, look at it like this. What if you were to contact your doctor and say, look, I still want to see you. How much would it be for me to come and see you, and then I just deal directly with you, and I'm not dealing with the insurance company? Because what you're doing is you're not telling the doctor, because I tell people all the time, don't go and say, look, I don't have insurance. That screams, I don't have money.
Right.
That's what that screams, like, oh, you ain't got no money. You better get away from here. No. You're not going to leave me with that bill. But if you say, look, I want to be a cash paying patient. We have this beautiful relationship. You know me, I know you. Even when I was using my health insurance plan, I always paid whatever the amount of the bill was that you sent me. So I'm good for the money. What if I could come in as just a cash paying patient? Would you still be willing to see me? Most doctors, and notice I said most, so I always come with disclaimers. So that's why I tell people, don't go out here and try this with everybody, because their doctors are like, no, ma'am, no, sir. No, if you ain't got insurance, I don't care if you want to be a cash paying patient. I don't care if Jesus came in here. You better have some insurance. So you got to check first. You got to do your due diligence first. Yes. Okay. So let's say this doctor said, yes, we can definitely work that out. And then that's whenever you say, okay, great. Mm-hmm. So what do I need to do? What's the next step? Normally sometimes doctors they're going to see where you are. They may say, okay, next time you come in, can you bring $200? And if you say, sure, I can bring that, better yet, can I go ahead and pay it now? And they may say out of 200, can you pay a deposit of $50? They just want to see where you are. But if that doctor sees that, this person will pay $200 up front, and it wasn't a question, and wasn't a problem, guess what? That doctor said, well, I can continue to see you. But what they're going to do is they're going to give you a discount, a big discount. And why are they giving you a discount? Because that middleman, that health insurance company, is now being cut out the picture. Now, like I said before, that affects people like me. So notice what I say, I'm cutting into my money, right? But like you said, I'm not here to sell, I'm here to serve. And I'm about the mission, not about the commission. So I always say, God gonna take care of both babes and fools. I ain't a babe, so you know what other category I normally fall into. But he still take good care of me because I believe in taking care of our people. And sometimes you have to go ahead and give knowledge and know how to do things. So that's why I say when I say about the health insurance company is cutting me out the picture too.
Wow.
Okay. So when you cut out all of that in the middle, because when it's the health insurance company, it's the health insurance company, then it's if I gave it all, I'm probably leaving out steps. Health insurance company, board of directors, CEO, all of those that fall up under that CEO, insurance agents, the ones who work in call centers, things of that nature. Health insurance is paying all of those sectors. Doctors, the physicians, but who's paying it? The individual. That's why, you look and you say, why am I paying so much? It's not about you, it's about the whole network. So when you cut that network out, now you have a direct relationship financially with that doctor. So what does a doctor do? They're going to give you a discount. Why? Because everything pretty much in a health insurance company is inflated. Why do you think when you go to the emergency room and they want to give you some Tylenol, and that's why I call it Tylenol 3. Tylenol 3 is $800. I'd be like, I'm not going to the emergency room because I'd be like, excuse me, I got Advil in my purse. I'm in pain, but no, I don't want that. I don't want that, sir. No, thank you. No, thank you, because you're not going to charge me $800 for a little pill. But everything is inflated because of the health insurance. But when you say, look, I don't have any health insurance, I'm going to pay cash. Watch everything get cut in half, because now that doctor's getting money directly from that person. And when they get it directly from that person, they don't have to worry about a payout. They don't have to worry about when they're going to get their payouts. Claims have to be processed. I've worked on that side of claims for a little while. Sometimes claims are backed up for almost 2 years. So a doctor sometimes is not necessarily making good money. I mean, they make good money, but they have to wait and get it on the back end sometimes because of how long it takes for claims to be paid out. This is money they're getting directly in their pocket right then and there. So of course they're going to give you a discount because they want you to come back.
Wow. Oh man, Shannon.
I know that was a lot, but I was like, let me get it in before I forget. I'm 48. I be forgetting stuff.
You are educating us, man. This is something. All right. So first of all, the first thing I'm thinking is, what a mindset shift. I mean, we have been programmed by these systems, by these institutions, to think and be a peg, a cog in this big, great machine. My goodness, this is tremendous what you're talking about, what you're saying. And I know that you have firsthand experience doing this. Like, you're not making this up saying, oh, you guys should try this. This is tried and true. And in a second, I want you to even give us some scenarios that you literally walked people through and how it worked out. I mean, even the disbelief and all that stuff, how you talk through that and work through that, and almost the pull and tug of people freeing themselves up to kind of walk in this space. And I also want you to talk about people who have no problem doing this, because we talk about elderly, seasoned. We talk about those who might more than likely are in our community, as Black women are in our community. I want you to talk about how this looks in other communities. But before we go there, here's a question I had. We're specifically talking about doctor's visits, right? Which is mainly what you're going to be encountering for the most part. Does this also spill over into hospitals? Because when you mentioned the emergency room, I thought about everybody I know who has had to go in for a minor procedure or, all the way through a major surgery that at some point has bankrupted them, or they're getting bills from anybody. If somebody poked their head in the room and said hello, you're getting a bill from them. They came and said, "How are you doing today, Ms. Brooks?" And that's all they did. You're getting a bill from them. You're like, who is that? What? So how does this apply to hospitals? Or if not, are there any alternatives in that space as well?
Oh yeah, absolutely. It definitely applies, to hospitals as well. Because just like I gave you the example, anytime you go into the ER and you look, sometimes if you get an itemized bill and you're like, what in the name of God is all of this? And you see things like $800, $1,600, $2,000. All of that is inflated. Because remember when I told you, once again, if you, have health insurance, or even if you're in a situation sometimes that they know, okay, you don't necessarily have it, but we're going to get reimbursed somehow. Sometimes it's the government, because you have two types of hospital. You have the for-profit and the non-profit or the not-for-profit. The ones who fall in the not-for-profit, most of them sometimes have things worked out with the government where all they do is just submit those bills to the government, and then the government will in turn pay it back within 2 years. That's why sometimes if you ever notice how medical collections only stay on your record for 2 years, that's why. That's why it doesn't stay on there like that for like the 7 years that other, like if you have a credit card, something like that. But they do that because of the fact of most of the time they're either getting reimbursed from the government or they're going to get reimbursed from what? Health insurance. But if you go into a hospital and you go in and say, look, I'm a cash paying patient, I don't have, health coverage. Or even if you do have it, you can just tell them, I don't have it. Because of the fact of normally, they may, pull your social or something like that. But, health insurance in the world of the hospital, it's about them billing. They're going to outsource it to whoever your health insurance provider is. But if you're not giving them one, they have nothing to outsource. But if you go and say, hey, look, I just want to I'm a cash paying patient. Then when they say that, then they're like, okay. And like, remember I told you before, a lot of times they're going to test you. Now, they may know now, most of the time, if you're going in the ER, something's going on, you're not thinking about your wallet.
Right.
But if you can say, you know what, I can get my spouse, I can get my son, my daughter, somebody to come up here. How much do I need to go ahead and start on this bill? Sometimes they'll just look and they'll say, oh, they're looking at your chart. Okay, well, what about $250? Do you think that, that can be given before we discharge you? Well, I don't know. Maybe I have 125. See, and then once again, you start to negotiate with them because they want their money. They want something.
Yeah.
But if they see that they were able to get at least say 125 out of you, now watch all of a sudden now all of those things that you didn't get before, that you got before, you're not getting. People like, oh, they're doing that to me because I don't have health insurance. No, they're doing that to you. They actually save you money because all the other things they were doing, they were just inflating what they were doing. Like you said, somebody coming in. Have you ever noticed how they come in and they make you wear that little thing around your wrist? And when you go in, they keep binging it. Every time they do that, there's something else. They're adding something else to your bill. But if you go in, like I said, once again, if they see, okay, this person has some cash, this person ain't playing, they didn't come to play no games. A lot of times they'll go ahead and, and not do all of that because they already realize that all that was just so they can just, inflate that bill so they can turn that into your health insurance, provider so that they can get paid whatever amount it is that they have negotiated with that particular health insurance, agency or whatnot. But a lot of times they'll cut all of that. Or if you get some Tylenol, all of a sudden you're like, what's this little $40, charge right here.
Right.
Oh, that was for like when we gave you 10 of those pills. So, you were here for 2 or 3 days. Oh, so that's how much it really costs. And that's probably, not all the way down to like say wholesale of it or whatever. But a lot of times, it's because of the fact they have they're cutting out that middleman. And what I tell you before, remember I say, I'm getting cut out of it too. But when they're cutting that middleman out, same thing like with the doctor, same thing with the hospital. If they charge you for every single thing that they did, it's going to probably be 50 to 75% off of what the bill would have been if you went through your health insurance.
Wow. Oh my goodness. Okay. Questions. So, do you have the ability to pick and choose? I think I heard you say this, but I'm not sure. The ability to pick and choose when you submit your insurance and when you don't. And I'm asking you that because if you choose not to use your insurance, is there somehow that you get dinged in the system, right? Flagged. And then in your charts or in, whatever system they have you in, it's showing that you are, a cash paying patient or something? Or is there anything negative that can happen as a result of not using your insurance, whether you have it or you don't have it?
Now this right here is where it can get kind of tricky, especially if you're coming from the world of having it. Okay. Let's say, for instance, give it, just like I said, this is just an example. Let's say you have ongoing high blood pressure. Okay. But you were using your health insurance to go see somebody that was in network. Okay. But a lot of times when you go to see people who are in network, and this is just my personal opinion, disclaimer, this is just me. A lot of times when you go see those when you're using health insurance, I really think they give you the cure. They're only giving you something that's going to help it's going to have a direct impact on whatever it is you're taking that medication for. But the bad side of it is it's the side effects. So a lot of times if you try to go and say, okay, I keep taking this pill, I'm exercising, I'm drinking water, I've lowered my sodium intake, I want to come off this pill. And I don't want to take this pill anymore. Well, let's say that you find somebody that's holistic. But when it comes down to the world of holistic, a lot of times insurance companies will not put anybody that's holistic in their in-network, category. And why? Because a lot of times that those that are holistic know how to give you the cure. So if you have health insurance and you go and say to your doctor, I'm over here seeing this holistic doctor who they have, given me the right kind of fruits, the right kind of vegetables, the right kind of lifestyle changes. Because a lot of times, sometimes doctors will give a diet. Diets are just something that's temporary. No, I need something that's going to give me a good quality of life. And if a holistic doctor is able to do that, and you go over here and you pay, let's say $200-$300, I'm just giving an example, $200 or $300 to a holistic doctor, but your numbers are starting to go down because they're giving you the cure. Then at that point, health insurance companies don't want to, deal with that. So they're like, no, we're not going to see you anymore. This doctor right here is not going to see you anymore because you're going against what we're telling you to do, whatever the case may be. And so then they can say, well, we're not going to see you anymore because you're being defiant.
Oh.
So then whenever that happens, then that's when you can kind of understand, like sometimes like where the world of health insurance is. And that's why I say sometimes when you get with the doctor or you get with, a physician or whatever, that's why I say you got to use your own discernment. Now, some doctors are not like that. That's why I say I'm not saying all of them, but I'm just saying in the world of health insurance and giving like the, an answer to what, you were describing, that's when sometimes when you're using health insurance and you're trying to abide by what they're saying, and then you say, well, I'm going over here. Well, guess what? Over here is giving you the cure. But over here, that health insurance, Are they really giving you the cure, or they just want you to keep coming back so they can keep billing? And the pharmaceutical side too.
That's right.
But it's like, but once again, if you go and just say, let's say they tell you, we're not going to see you anymore. Okay, bye.
Mm-mm-mm.
But you go over here and, yeah, you may pay out of pocket, and sometimes you're going to pay a little bit more because it's authentic and what they may be giving to you, but they may give you the cure.
Wow. Yes, my goodness, so much to think about. So caregivers, please think about this in terms of options. These are options.
Mm-hmm.
Shannon is telling us about things that we probably have never heard before. I know I never heard it before I heard Shannon present before. I had never heard this. I was so intrigued. And because of the way we are wired, at least, in this country, I was like, this can't be right. What she said, it just can't be, because how isn't that more people don't know about this? What you talked about is the way we approach medicine here, Western medicine, right? And to your point, there's lots of people who, when they get a really bad diagnosis, they are into the Eastern cures immediately. Because somehow over the years, we have heard that this stuff works. I feel better. Numbers represent the change that I'm seeing immediately. I mean, it's so impactful. But tell us about the disparities that you see in how this is carried out, how it looks in our community versus other communities who try to implement this with their medical folks.
Okay, well, I guess I can kind of go ahead and just kind of start with us. And once again, it's sometimes hard and difficult and challenging because, once again, we as Black people, we get used to a certain thing. And sometimes we don't like change. And I'm talking about myself too. So I can't talk about nobody else, so I look at me.
Yeah.
But a lot of times we don't like change because it's just what has been ingrained in us. Like when we first started a full-time job, back in the day, you were full-time if you had 32 hours. What they start offering you, health insurance. What your parents tell you, you better take that insurance. And they always said, don't leave that job. You're leaving them good benefits. You got that good insurance over there. So we think, okay, I get my job. Now I got to take the health insurance. Now I've arrived. I can go see a doctor about anything and I'm going to have coverage, whatever. And that was the case back in the day. Back to me, when health insurance was actually affordable, it was decent. You paid your copay if you had an extra bill or something like that you had to pay. It may have, been say $100, $200, $300, something that was manageable. Okay. So we were doing what we were accustomed to doing. We were doing what we saw our parents do, what our grandparents did. So here we come doing it. So whenever we're trying, somebody says, well, have you thought about this? I can't do that. I can't do that or whatever. No, I'm not leaving my insurance. I'm not getting ready to try that. That doctor's not going to cover me. And, the thing is that once again, because it's not taught to us, because another thing about it is that we have been, I guess, what's the word I'm looking for? Raised or whatever to trust a doctor. I'm saying that you should not trust your doctor. Please don't think that. Like I said, I am not saying that. But I'm saying we have been accustomed to, saying we need to go to the doctor for this. We need to go to the doctor for that. And you should. Don't get me wrong. If that's where you are, yes, by all means, go get yourself checked out. I'm not saying not to, to keep doing what you're doing. But the thing is that when we start thinking about, oh my God, like we think, if I don't have health insurance, it's going to be so much more expensive. Like they make us feel like health insurance is a discount that we're doing. Like we're not paying all of this. So I can only imagine what it's going to be like if I, let go of my coverage. I'm not going to be able to afford going to the doctor. I can't afford those payments. Now, That's how we have been accustomed to think. Others, most of them don't even look at health insurance. Most of them don't even want health insurance. Most of them opt out of it. And why? Because they're the ones that have been practicing this forever. Most of them go and get the cure. Like I'm just going to and I'm just going to give this is just like I said, an example. Somebody in a Black household, when it come down to, to most families or most setups of a Black household, they'll say something is hereditary, and it's not. Because if we all sitting around the table and we're all eating pig feet and chitlins and things that, it just goes along with what we had to eat back in the day, that was, that we could afford, or what the slops, the sloppy seconds sometimes. And yes, that food may taste good, but think about it. If all of us are sitting around the table eating like that, we're all going to develop something. But they have it in our minds, it's hereditary. No, it's not, because I sat at the table where mama sat. Mama sat there where grandma sat. Grandma's sitting where great grandma sat. And everybody's eating the same thing. But see, there's also things that they can give you through a holistic approach. Or some doctors, they can give you a cure to say, okay, if you want to eat your pig feet, make sure you do this, 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 and this to make sure that your blood pressure stays regulated, make sure that your diabetes doesn't show up or whatever. They can do that, but they're not going to do that. We just go to the doctor. They're like, oh yeah, we see that you've been eating like that again. Well, it's hereditary, but instead, let me give you this pill. Oh, thank you, doctor. We're going to take that pill. Over there on the other side, they'll go out here. They like going and getting in the sun. They like getting diet drinks. It's not that they don't eat, equivalent to, something that we're eating, but they get cures and they go to holistic approach. So if they go to a doctor, they may go to one to get a physical for a job, but they pay out of pocket. And normally they ain't paying them like $50, for that physical. So they go over here and get all the cures. And then what they do is, if they, let's say they're like, okay, I need to go and get something done, this $5,000. They just make a payment arrangement. They're not going to put you in. A lot of times they tell you, how much can you pay? I can pay $10 a month. You have it set up, drafted out of your checking account or your debit card or whatever on the first of every month. $10, that keeps you out of collections. That keeps them from calling and harassing you. And no, they may not ever get that $5,000, but they're getting something out of you. A little bit of something is better than a whole lot of nothing. So when it come down to it, they're not going to the, and I've even been told this, they was like, Shannon, a lot of times, those who are in a certain economical category follow systems.
Yep.
And we don't follow the system because we're not in that economical category. We create our own systems. They're the ones that kind of created this. They're the ones that sat back and said, why would I want to go and pay a middleman all this money? And I don't know that middleman. I don't care about that CEO. I don't care about that insurance agent. I really don't care about them call center reps. Why am I going to pay them? They're not doing anything to help me or my family. But when I go over here and I can go see this doctor and I tell him, look, doc, I need to come in. What needs to be seen? I've got a little pain on my side. Okay, what all needs to be done? Give me an estimate of what all I need and how much I need to bring in. They'd be like, okay, let me go ahead and get with my my bookkeeper, secretary, whoever it is that got all that, whatever. Okay, they call back. Okay, $500 altogether. Okay, when can I come in? I'm gonna bring you $200. See how they're the ones that's in control, and the doctors know that, but they want them to come because birds of the same feather flock together.
Yeah.
So if the doctor's taking care of that one, they're gonna go tell Susie, they're gonna go tell Bethany, they're gonna go tell Ginger gonna tell Bob, all of them, the whole family going to this one doctor, and the doctor just making money hand over hand because they're getting that money coming in directly to them right then and there.
Oh my goodness.
That's the difference between our people and, like my mama said, them other people.
Yeah. This is something, and you even talked about it right there at the end, the socioeconomic disparity, right? And the truth of the matter is, anybody who are in these socioeconomic lower tiers are subject to this system. So even if our white counterparts are, lower income, they're already programmed into the same system as well. So it's not always just, strictly black and white. It's more socioeconomic, where you're just caught in this web, right? Because there's a lot of people who don't look like us, but they're having the same struggles. It's the same thing. I think about something you said earlier in terms of how expensive it is and how lots of people opt out of insurance. Think about when, you either got laid off or left a job or whatever happened, and you had to come out of your insurance, and they presented you with what? Cobra. Are you kidding me?
The devil.
It was just the worst thing. I couldn't understand it. So now I don't have a job, and you're going to charge me 10 times the amount to cover myself for insurance. Like, what planet, how does this make sense? And what is that about, Shannon? What is that about, that you're paying more for even less coverage, and you don't even have a job? How can they even do that?
Well, now I can tell you what Cobra is. So Cobra pretty much is how much it would have been. Normally you coming off a job, you're in a group plan. When you're in a group plan, across the board, it's going to be a lot less because the cost is divvied up amongst the people who are in that company.
Okay.
So a lot of times, like me and you could be, in the same company, and I may pay a little bit more than you, a little less, depending upon where we are age-wise. So sometimes you may see where it's a tier of those between 18 through 25 will pay this, 26 through 34, 35 through 45, 46, it'll go like that. So sometimes it's in a situation where every employee is not paying the same amount, but they're still getting a good discount. When you step away from that group plan, by law, that's where Cobra comes in. They still have to give you the option to keep it going. However, at that point, it's not necessarily based on your health, but it's going to be based on your age as an individual with an individual plan.
Wow.
And so now you go from, let's say you might have been paying, say, just $200 a month. $100 every time you got paid. They just took it out your paycheck. Well, now it's $1,200. Why is it $1,200? Because now it's based on the age that you are at the time that you are, and it's based on the package that you selected. And most of the times when you get a job, what they tell you to do, get the top tier. Everybody going for that top tier package. Don't nobody want the bottom level. Don't nobody want to feel like start at the bottom and I'm still here. When it come down to, health insurance, everybody goes for that top tier package.
Right.
But when you come out, you still got that top tier package. You just gonna pay for that top tier package out of your own pocket.
Yeah. Oof. Man, thank you for that. Again, as you're talking, just ideas and thoughts are coming into my mind. So how does this look for the caregiver? How can we as caregivers of our elderly loved ones navigate this space, like you said earlier, for both ourselves as we age and the elderly loved ones that we're caring for?
I think a lot of it is, as from the caregiver standpoint, is just being able to break it down in terms that someone that is seasoned can understand. Having patience, number one, because that's the thing. You have to have patience. You have to have compassion. You have to have grace and mercy, because once again, we're talking about a generation that is about systems. And our people have been used to systems. So it's not going to be something you can just sit down and just say, hey, we're going to do this. And what you mean I'm going to go in there and tell them I don't have my Medicare or my Medicaid or my Humana or whatever it is that they, may have. But when you go in and you can say, hey, look, let's look at some options. I want to put some money back in your pocket. I want to be able to have that, where you can, go. Wouldn't you like to go do something else with your money? Wouldn't you like to be able to go whatever, like I have to give my mom an example. My mama like going on those little trips, that they take, on them buses where they go up to Cherokee. So she like to go up there sometime. They like to gamble their little money and stuff like that. But it's like, if you can say, look, wouldn't you like to be able to have some more coins in your pocket so you can go? Well, yeah. Well, let's look at some options.
Nice.
Put it into words in the terms that they can understand, that how it can relate to them.
Mm-hmm.
Because if we try to make it relate to us, they don't care. They're like, I know this ain't got nothing to do with you. This is about me and my money and my coverage or whatever. It's like I'll tell somebody, you don't have to stop your coverage. If you're comfortable with it, this is not about, saying, let me terminate what I have. It's just about saying that sometimes if you just go in there and just don't say something, then maybe we might be able to get you, save you some money. So as a caregiver can say, hey, mom, hey, dad, hey, grandma, granddad, whoever. I think that if we go over here to Walmart pharmacy, and instead of telling them that you have health insurance or you have some kind of, plan, we may be able to save you some money. I might be able to go in there and tell them that, you know what, they don't have health insurance coverage anymore. What you have in the system is no longer valid. Mm-hmm. How much is this going to be out of pocket?
Yeah.
And I said, and then get, because they'll give you the answer. They'll be like, okay, out of pocket, it may be $25. And you can look and say, hey, look, see, like you might be able to, to write stuff down. They're that generation. You can't show them stuff on that phone and think that they're like, I don't want that. Like, no, write it down. Like if you have a piece of paper and you say, here, Walmart. Look here, we went to Walmart. Remember, Mama, we went to Walmart? Well, see, that nice young lady said you can get 30, day supply for $25. Remember she said that? Well, yeah, I do remember whenever she said that. Okay, now remember whenever she said that if you use your health insurance, it's going to be $100. You remember that, Mama? Okay, I remember that. Which one do you think we going to do? Maybe I want to do that $25. Okay, let me go in here and let me take care of it. You stay out here, take your shopping cart, go get whatever it is you want to get. Stay out here in the car, listen to your Kirk Franklin, whatever you want to do, just let me handle it. And then that's how you can kind of, as a caregiver, kind of start to get them to understand. But you can't just come at them and just say, hey, we're going to do this new technique and it's going to save you some money. No, because now you're making them feel like they don't have control. Mm-hmm, mm-hmm. And the one thing about it is that, yeah, they may be older, but they still want to feel like they're in control of, what they're doing. They want to be in control of their plan or what have you. Mm-hmm. It's just trying to just say, hey, look, take something that they really, truly enjoy. Yeah. If it's a thing where they like going, say the church does some kind of outing, does some kind of ministry. Hey, you know how you like going out, and you know how you like, getting the flowers. You're in the, flower club at the church, and you know how they always talk about how beautiful your flowers are. Oh yeah. Well, you want to save some money so you can go out there and plant some more flowers, and you can give some more people. Oh yes, I do. Well, let me help you save some money. Let me see what I can do to get you, on a better plan, give you some better options that we can try over here. Okay, you can do that. Sometimes, it's not saying, I always say it's not about tricking them, but it's about just saying, let's try to change this mindset. Yeah, and some of them are gonna do it. Some of them gonna be like, I don't care what you say. Put my insurance on there. That's illegal. That's this and that. If that's how they feel, okay, back up. Be like, we'll do it your way then. But if they can change that mindset just a little bit and know they can save them some money.
Oh, that is perfect. Meet them where they are. Mm-hmm. Meet them where they are. Don't try to force it. And your loved one, so you know what's important to them and how you can broach these subjects and what will make a difference. Oh, that's great. Also, you talked about how not rendering them helpless, right? We want to retain their dignity here, right? They're in a season that they're losing so many things. They're losing the ability to be independent every day, And to the extent that we, as their caregivers, can honor them
Mm-hmm.
and keep the dignity intact as much as possible. I mean, you can do it. And there are just certain ways, there are nuanced ways that you can do it, right?
Mm-hmm.
And I loved what you said earlier. And one of the greatest ways is to be patient, extend grace, because although you're caring for them, imagine what they're feeling like, because they're the ones who are going through this,
Mm-hmm.
this, aging process. They're ahead of us. They're experiencing things for the first time.
Mm-hmm.
They don't know what to do with it either, right? So there's just so much going on. Shannon, this is incredible. One of the things you talked about in terms of eating are our eating habits, right? And a lot of times we just get tagged, this is hereditary, and it may or may not be. But we think about back when our parents and our grandparents were eating these types of things. Life was different. There was a completely different lifestyle. Physical activity was mostly what we were doing. We
Mm-hmm.
weren't sitting at desks all day, just sitting down. If you were a child, you were outside playing. If you were a child, you had physical education in schools. Like, we were a more active society. So it would counterbalance some of the bad things we ate. Oh, and by the way, our food sources have been completely contaminated and changed since the last generation. Okay.
Mm-hmm.
So we're developing allergies to foods that we ate all of our lives. And it's like, now I can't eat this. It's not because not because you have developed just this lower immunity to tolerance. It is because of the food source has hormones and preservatives and garbage in it to, make a little chicken look like as big as a pig.
Mm-hmm.
Like, really, something must be wrong here, right? So lots of things to consider, and that's also a great way to broach these topics. Is that, yeah, you're not doing anything wrong, but our lifestyles have changed, as have the food sources. Man, so many thoughts. I know that we're coming close to wrapping up. Still have a few more minutes left though, but are there any real life scenarios that stick out for you? Whether it is with, your mom, your grandmother, or with one of the family that you call them, that you're serving, where you talked about this. And tell us about, maybe a scenario on both sides where someone was completely adamantly against it, where someone might have even thought you were leading them to do something maybe illegal, right? And then someone who was like, wow, thank you for this. Has really changed my life. And because I'm on a small budget, right? I'm on a retired budget.
I would say probably the one person that I listened to that I wish he was still here was my dad. Because my dad was real big on, natural and authentic, supplements. And the reason being is because my grandfather was a doctor.
Nice.
And my dad used to say back in the day, a doctor was supposed to give you the cure. And so my dad would sometimes tell me about when his dad, my grandfather, would get a call from someone. This is when they did house calls.
Wow. Yes.
So they would say, Dr. Wilson, that was, my granddad's last name, Dr. Wilson, I keep getting this headache, or I keep having this or that or whatever. And my dad said he had a book that he would go to. And in the backyard, he had all these, herbs and, just natural supplements that he was growing. So he would go, he would listen, he'd write down everything that you said was going on. And then he would go to his book And then sometimes he would call up, some of the elders that were at the time, and he would say, hey, I got somebody that's, that needs this or that. Because my dad said back in the day, yes, we had a lot of knowledge, but we also had wisdom. He knew how to go and talk to the elders. So they would say, well, baby, because my dad is David and my granddad was David. So they called my granddad David Sr. David Sr., all you need to do is go back there in that backyard and just get XYZ, whatever. And if you need, come on back here in my backyard. And, I got that same plan. He would go back there, work whatever he needed to work with, come, give that person whatever it was that they needed. And they may not have, let's say, been cured overnight, but eventually just doing that. And like you said before, having that physical, movement out doing something, walking or whatever, so eventually they would actually be able to, in a sense, cure themselves. So like my dad told me, he said, for instance, high blood pressure. And my dad was a Muslim. So a lot of times, me and him used to get into it. He called it swine. I'm like, I don't care. I need my pepperoni pizza. I may not eat no pig feet, but I'm going to get my pepperoni pizza. And you ain't going to give me no turkey, based pepperoni. I need my pepperoni. But he would always say, people want to eat the swine and, sitting around the table, if everybody eating, and most likely everybody going to get sick or everybody going to have some kind of ailment. But he was like, high blood pressure. And I even learned this from my great grandmother. High blood pressure can be cured through apple cider vinegar and lemon juice. Taking a swig of that every single morning and then eating at least 2 pieces of toast or some kind of bread that can absorb some of that acid that's going down into your stomach. And then drinking room temperature water before you go to bed and drinking it whenever you wake up. That helps to regulate it.
Wow.
So when it comes down to it, think about it. Back in the day, you had people back then who had high blood pressure, but they were living long, like 80s, 90s, to be 90, sometimes even 100 years old. Why? Because they were given the cure.
Wow.
And then a lot of times when it come down to the flip side of it, I've even had to, try to tell people, and sometimes it be my own people, that they have given me, pure, what, because I've tried to tell them the same thing. Well, that was back in the day, and things have changed. Yes, things have changed. But to me, things sometimes have gotten a little worse. And it's not worse as far as what the cure is. Like you were saying, it's worse now because everything out here is cloned. Like I'll be the first to say it. I know I may, shouldn't say it, but I'm gonna say it. Think about Kentucky Fried Chicken. Kentucky Fried Chicken ain't been chicken ever since they took the words Kentucky Fried Chicken out of it. It's KFC. Why can't we call you Kentucky Fried Chicken? What is that you're putting up there? Because they don't even look like chicken.
Yes.
We eating.
Wow.
But the whole thing is that if we're sitting there doing that, and guess what that feeds into? That feeds into me going to a doctor. That doctor feeds into the pharmaceutical, industry. But when it comes down to our people, and I try to tell them, oh, that's a conspiracy, that's illegal, I get the most pushback sometimes from our people. When I go over here to other, cultures, they're the main ones. I don't want that health insurance because let me tell you about what it's doing. They're the ones that's like, thank you, Shannon. Thank you for coming over here to talk to my mom. Thank you for coming over here to talk to my grandma. Thank you for getting on this Zoom, or whatever, because some of the things that I didn't know, but I now know. Because they know that, most of them have something like this, and they already know, like, I can save my money, while our people think we're saving money by getting a health insurance plan when really we're not.
Wow, Shannon. This has been great. I mean, this is truly educational. It's something that people are not out there talking about. And I'm just so glad that I got to hear you present. And I said, man, my caregiving community needs to hear this. Now, y'all, whatever you do with it, that's on you. But I am committed to bringing you experts in the space of caregiving for your elderly loved ones. Every aspect that I can think of, or ones that you even suggest, because this is a hard journey, right? And it's going to touch all of us at some point in our lives. What I heard the most, Shannon, is that this is about exposure and access to information. And I thank you so much for doing just that today. Before we wrap, I always want to let our guests tell us if there's something you'd like to share with the community about what you're working on, any projects or programs, and how we can get in touch with you.
Okay. Well, let's see. Right now, I'm more so I'm doing a lot on the financial literacy side. I know that's kind of different from the healthcare side of things, but I am working on doing things like presenting financial board games and financial vision board sessions, and I'm also working on a coloring book for financial literacy. So I've got those three things that I'm working on, just trying to get some logistics put together. But on the side of healthcare, the main thing that I just tell people is use your discernment. Make sure you research. Just don't take what people are saying to heart. Me, anybody else, do your research. Make your phone calls. Call your doctor. Call the hospital. Call the physician. Call whoever you need to call. Sit down. Pray about it. Whatever. Just to see, if it's whatever it is that I'm saying is going to resonate with something that you need or that you need to do. So that's the biggest thing I would say, from my standpoint. And if anybody would like to reach out to me, I'm old school. You can give me a phone call. My number is 336-486-9151. I'm also on Facebook under my name, Shannon Brooks, in Winston-Salem, North Carolina. I'm trying to think, because I think that's about, let me see, is there anything else? Because like I said, I don't do all that new stuff and everything. Now that get on my nerves. So yeah, my nerves bad. So yeah, like phone call, just, if you call me or just want to text, hey, look, you on the podcast. I have a question for you. I have a concern, what have you. I'm big on education. So don't think you're going to, call me and I'm going to try to sell you on something. I'm not big on that. Like I said, I want to serve. Yeah. So I would say that's probably the best way to get in contact with me. Phone. Like I said, Facebook. I'm on LinkedIn as well. Once again, under my name, Shannon Brooks. Look for the one in Winston-Salem. So I think that's pretty much it. I don't think there's any other. I mean, I have other methods, but I very seldom use them. So I don't want to tell somebody to reach out to me there, and then I don't respond because I'm just not over there.
Right. No, I understand. Shannon, thank you so much.